Hey guys, this is Diogo Cherry-san. I'm gonna discuss something that I'm asked about a lot, which is what causes arthritis. There has been an effort to show that heavy lifting causes arthritis, sedentary lifestyle, genetics, popping your joints, and they're all inconclusive. A lot of them are debunked, the other ones are inconclusive. The truth is, all the ones I mentioned can be associated with arthritis, okay? But they have all been debunked. And I'm gonna talk about them separately. Some people, heavy lifters in the past, like Ed Cohen or Schwarzenegger or Sylvester Stallone is in great shape nowadays. They're still lifting and they look amazing. Their body looks pretty strong, and you cannot associate the heavy lifting with any sort of arthritis or degeneration they have nowadays. Okay, popping has been debunked for a long time. There was a doctor that I don't remember the name, but he popped only one of his hands for 40 years, and then they took x-rays of both hands, and the only hand that he popped for 40 years looked exactly the same as the other hand. There are other studies also about popping the joints, and uh, that has never been demonstrated to be associated as a cause of arthritis. Genetics is a big one. They show, and it's really easy to identify that that genetics can cause a rheumatoid condition, autoimmune response, because it's in your gene and you can develop it. However, some people don't. Some people have that in their genes and we know that they don't develop, which it does raise a question mark. Genetic cannot be directly associated with the cause of arthritis, because some people don't develop. So what we want to know is, what are these people that don't develop arthritis doing? What is different in their body, in their DNA, in their genetics, that they don't develop the arthritis? And there is, in epigenetics, there is a discussion that you can change that. So even though your genetics are predisposing you to have it, you have an active, healthy lifestyle, that you can beat that, and your body can be healthy until you're 90, 100 years old, and you never develop the the deformity and the autoimmune condition or the arthritic pain. So I have to talk about soft tissue adaptation to clarify those discussions of arthritis, okay? Because some sedentary patients develop arthritis, some don't. Some heavy lifters develop arthritis, some don't. Some people that have the genetics predisposition develop arthritis, and some don't. What we do know is some people have shown amazing feats of strength, hardness, like breaking really hard stuff with their hands, running 48 hours marathons without resting, those Ironman, like crazy competitions. And we do know, and it's a proof, that the body is capable of amazing, unimaginable things. So from a biological perspective, you cannot compare soft tissue, which is mainly what wears out to then cause the arthritis. It's pretty much the hyaline cartilage that covers your bones surfaces, and the fiber cartilage in between, like in the case of the meniscus. We cannot compare those soft tissues with a piece of rubber in engineering. A piece of rubber will wear out until it tears apart. That is not how it happens with soft tissue. And we have believed it for way too long. For too long we believed in protecting the body, not stressing the body, and protecting because it's gonna wear out, tear apart, it has a lifetime, and then you're done. Cardiac surgery in the past used to have a super high death rate, and I don't know exactly the number, but it was a ridiculous, like 75% death rate, because the patient was bedridden for too long. So the technique changed, but they also changed of getting the patient up and going, walking and exercising, and that has shown to decrease mortality and comorbidities. In surgery, it's getting the same, like in orthopedics, open reduction, internal fixations, joint replacements. Not only the technique, but the knowledge of partial weight bearing to full weight bearing, exercising earlier, causes less comorbidities, less problems, less side effects than just resting it all the way through the healing process. Okay, reason being is, like I said, biological tissue is adaptable. In the beginning, your bone is kind of more like a cartilage type, because it is cartilage in the beginning. When you're partially weight bearing or just doing ankle pumps or isometric exercises, that is attracting calcium. The calcium start depositing in that cartilage, form a little callus that then will be remodeled, and then when you start strengthening and lifting heavy, that becomes a strong bone. The frame changes, the osteocytes readapt. That's the reason you start with partial weight bearing to full weight bearing. How does that apply to exercise? There has been a study where they take a little sample of a meniscus of an athlete before his warm-up and one after the warm-up. Okay, not talking about several weeks or anything, just a regular 20 minutes, half an hour warm-up. Before the warm-up, all the cells are misaligned. They're not prepared to receive tensiles and compressive forces. And after the warm-up, they realign. Where tensile forces happen, they align to receive tensile forces. Where compressive forces happen, they align to receive those compressive forces. Okay, I'm talking about a half an hour warm-up. So that explains a lot about sedentary lifestyle. People that don't load their bones up with weight, they don't load their muscles with weight, they don't load their tendons with weight, with impact, some running, requiring some strength, stressing the body, pushing the body to a different limit of just, as compared to just standing up and walking. On top of it, they have sedentary jobs. Okay, so the number one thing that is the most related to arthritis is sedentary lifestyle. The most. And it can be demonstrated. Okay, it's very easy to be demonstrated. I've been in orthopedics in outpatient physical therapy for around 7 years now, and I can tell the top of my head, this is not precise, this is not a research, but the top of my head, 90% of my patients that are in really, really bad conditions, they're not strong, they have really poor balance, poor neuromuscular control, they were sedentary. And a lot of my patients that come with like minor stuff, or they're recovering really well from surgery, they have really great balance, they have been dancers, athletes, they still exercise, they're active, and their outcomes is like way better. Now, still talking about working your way up, staying fit, and soft tissue adaptation, some people have demonstrated some feats of miraculous strength and hardness and resistance in the body that really is truly mind-blowing. Like I mentioned, running a 48 hours marathon, or deadlifting over 1,000 pounds, or bench pressing. There was a guy that bench pressed, I think the world record's already over 1,000 pounds. That is insane. Okay, you cannot look at a single tendon, do like a in a cadaver, like a tension test, to see how much pressure it can get, how much it takes to rupture a tendon, and apply that in real life. Because in real life, there is a mind connecting to the body. The biological tissue adapts. It adapts to the environment. It adapts to the stress. And we don't know the limit. We don't know the limit. Some people believe it's unlimited. And I have seen myself some really truly science defined things that people do without even thinking about it. You know, they're just strong minded and just go and do it. Okay, so back to the arthritis subject. Science still doesn't know what causes arthritis. What we do know is biological tissue is adaptable, and it is undiscussable, hands down. If you stay fit, you stay strong, you exercise regularly, you will have a way better outcome. And your body has an amazing power of adaptation. Adaptation to tension, to compression forces, to stress, and that will keep you strong and young for as long as you live. That has been shown. Okay? Let me know your feedback. Let me know what you want to know more about. Let me know if you like this video. If you want to receive more of the same, hit the subscribe button. I'll be a little more proactive in this channel from now on. Like the video so YouTube can send you more of the same, so you can follow up orthopedics. I am dedicating this channel to understanding orthopedics. I don't do much self-mobilization, you know, self-treatment, which I do, but it's more about clarifying and understanding the human body. Let me know what you guys think about that. If you like that idea, I feel that that's what's missing on the internet. I said that in my first video. If you go back in the first video that I posted in this channel, that's what I'm talking about. I created it for this reason, just to spread orthopedics knowledge. All you're seeing behind me, you know, are a lot of orthopedics books, and that's my passion. Let me know what you think. Give me your feedback. Subscribe to this channel. Thank you so much.